If I got diagnosed with cancer today, this is what I would do as a hospice nurse. I see patients with cancer and hospice care day in and day out, and millions of people get diagnosed with cancer each year. So here's what I would do as a healthcare professional. So here's the difficult thing, and the thing to keep in mind. All cancers are different. There's going to be different answers for this question on what to do. I am not the expert, but I do know the questions I would ask my oncologist if I was diagnosed with cancer. So number one is, what are the statistics of this cancer? Is it a rare cancer? Is it a common cancer? Is there a common standardized treatment for this cancer? What are my survival rates? Is it 2 years, 5 years, 10 years? The reason why I'd ask this is because there are some cancers, like pancreatic cancer, that usually is a terminal diagnosis, and people usually die fairly quickly from this disease. Whereas there's certain types of breast cancer that you can live a long time with breast cancer or prostate cancer, depending on the stage. So it just depends on what type of cancer it is, but that is why I'd be asking these questions, because it's going to gear me to know what kind of treatment I want to do. This also helps me know where I'm at in the disease, what stage I'm in, which again will help me choose which path I want to take as far as treatment or no treatment. Which leads into number 2. Is this cancer terminal? I would just ask that flat out. Is it terminal? Am I going to die from this cancer? And if so, what is the typical length of life? I think being so straightforward about this helps your oncologist be straightforward back. You can also ask your oncologist to be as straightforward as possible if that's what you want. I personally want that because then I know how to make my next decisions. The problem with not being straightforward, I think, is because a lot of people who work in healthcare, I'm guilty of this too, automatically assume that people know the things that we know, and they don't sometimes. So if you are super straightforward about what you're looking for, they can be super straightforward to you back. So if you are straightforward about, is this cancer terminal? They know exactly what you're asking. So they will hopefully give you a straightforward answer back. And if it is terminal, you can ask, well, how long do people typically live? That's a very straightforward question for them to answer for you. Number 3, and this is very important as well. What is the progression of the disease? Again, many healthcare workers will take for granted that you know what they know, and you don't most of the time. So specific cancers do have a progression. Also, certain cancers will have certain symptoms. So you want to ask about, what's the progression like typically? How is this going to affect my life? Am I going to be able to continue working? And then lastly, what are the typical symptoms you see with your other patients? Again, certain cancers are going to bring about certain symptoms. They may have a certain progression, a timeline. You want to know typically what they see. And if they kind of give you the runaround, well, everyone's different, it's hard to know, I would keep pushing. Just because it's better for you to prepare and to know what to expect in a general way, again, so you can plan your life around this. What are the treatment options? I want to know every single treatment option. Now, there are some standard types of treatment for cancers that are common. You know, they do X, Y, and Z. That's what everyone does nationwide. So it can be a quick answer. However, there are some other ones where it's like you need to specifically say to them, I want to know every single option, including what if I don't do treatment? Then I would ask, what are the symptoms that I'm going to have because of this treatment? What do you typically see? Many treatments that are helping you are also hurting you, which some are worth it and some are not, right? So you kind of have to weigh it out yourself and ask the professional, the person who sees this day in and day out, you know, what symptoms can I expect from this treatment and how are you going to help me with those? And then lastly, how long is this treatment going to last and what is it going to entail? Am I going to be having chemo every week? Am I going to be having radiation every day? Are there multiple surgeries to be had? How long is the downtime? So if you have radiation, what's the downtime for that? And are you going to have symptoms from that? If you have chemo, are you going to be feeling sick afterwards, or is this a gentler chemo? Are you going to have it like an IV placed every time you go in to get the chemo, or are you going to have a port placed so they can just access the port? These are all the questions you want to ask your oncologist just so you can better plan. Number 5, if I do choose treatment, what is my survival rate? Will it extend my life 2 years, 5 years, 10 years? And what's my quality of life during treatment and then after treatment? What do they see with their patients? The reason why I feel like this is so important is because there are certain types of cancer, to me, that we may overdo treatment sometimes, in the sense of, is the treatment really worth it? Is the treatment really going to extend my life? And if it is, what's my quality of life going to be? Typically, treatments will extend someone's life. I do find, though, with certain diseases that they may keep doing treatment too long, in the sense of like, maybe it's going to work, but maybe it won't. Meanwhile, the person's not having a good quality of life and it's not truly going to extend their life. So it's just important that you tell your oncologist what your goals are and they be realistic with you. Number 6, you'd want to ask your oncologist if they'd be open to putting you on palliative care or hospice eventually. I ask this question because I want to gauge their knowledge about hospice and palliative care. If they immediately say something like, oh, no, or they act like they don't know much about it, to me, that's not a good sign. Even if they work in a type of oncology where many people aren't terminal, I still would like an oncologist who is informed about palliative care and hospice. And truthfully, we don't do this in healthcare yet, but I really think palliative care should really be started the second you're diagnosed with something like cancer. Because palliative doesn't have to be end of life. Palliative is just treating you as a whole person to help with your symptoms, whether it's from the disease or from the treatment of the disease. And then along with that same line, I would also ask them, do most of their patients eventually go on palliative care and hospice? If so, when? If so, when? So that's going to tell you where is your cancer more life limiting or is it not? Number 7 is an important one. You want to ask your oncologist, what are all the treatment options? So not just the ones they recommend, but any treatment option, including not treating the cancer and either going on palliative care or going on to hospice, what they think. Now, I'm not saying that should be the option either, but I would just want you to know, and I would want to know all the different options if there are some. Also, if they wouldn't recommend certain ones, like let's just say I wouldn't recommend you just not treating it at all, I would want to know why. Why do you not recommend that? Because sometimes there is a really good reason. Like, well, if you don't treat it at all, you're going to have a lot of symptoms because of X, Y, and Z. But if you do treat it, you won't have those symptoms. That's a good reason for me. So you want to make sure you're just asking them direct questions and having them explain to you why they're saying the things they're saying. Again, like I said, there are certain cancers that are curable, at least for, a 5-year survival rate, 10-year survival rate. Those ones we are pretty standard in treatment, but it's still important to know the different paths either way. Some examples of like standardized care, most of the time, like if someone has prostate cancer and it's not metastasized, there's a standard level of care all hospitals will do. Or if you catch colon cancer early, there's usually a standard type of care. So you have surgery, you may have a certain type of chemo, and almost every hospital will be doing the same thing in that standard care. Certain types of breast cancer, there's certain types of care that has been clinically studied to know you do X, Y, and Z, and you will do well. There's other rare diseases that you may find different options depending on where you go. Number 8, once you decide on the treatment plan, as you go along, I would continue to ask your oncologist or whatever doctor you're seeing about the symptoms you're experiencing, if they're normal, what to expect along the way. If you're starting a new chemo treatment, again, like what to expect along the way, just so you don't get any surprises. And of course, ask them why you're feeling certain symptoms and how they can help with those. Also ask them if this is just a short-term acute symptom or if this is something that you should plan to see chronically. Number 9, and this is maybe the most important one, even though I keep saying all of them are important. I would always ask what my oncologist would do if they were diagnosed with this disease. Always, always, always. I would always ask if they were diagnosed, what would they do? Or if their mother was diagnosed, what would they tell her to do? Any oncologist, which you may get some pushback, they may say, well, I can't tell you what to do. This is your decision. I would still want to know what they would do. And any oncologist that isn't willing to answer that, I would feel uncomfortable with. I would want an oncologist that's able to be human with me. And I think it takes a real human to be able to empathize with what you're really going through. So I would want an oncologist that would be willing to tell me what they would do. And last but not least, number 10, if you aren't vibing with your oncologist, or you're not trusting what they say, or you just don't get a good vibe, find another oncologist. It's important to feel comfortable with the person you're working with. However, please know that there is a time restraint here. It is important to treat what's happening in your body as early as possible, so don't wait too long. If you need to get a second and third opinion, try to hurry those opinions along. It's important to stay informed, and at the end of the day, this is your life. I want you to do what you want to do. There is no right or wrong answer here. I truly mean that. I'm not saying one is better than the other. The only thing I want you guys to have is information. I hope this was informative. I hope this helps. And don't forget to subscribe for more death and dying information. Love you guys.